Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts. They are coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Von Do Reynoso, and Dr. Henning Ansorg, the county's public health officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Kim Rich. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSB TV 20. And with that, I will turn it over to County Public Health Director, Dr. Von Do Reynoso. Welcome, Dr. Do Reynoso.
Thank you, Gina. And hello, everyone. Happy Friday to all of you. I would like to start this briefing with some data from our county. Okay, I have the slides. 63% of our 75 plus year olds in the county have been fully vaccinated. That's wonderful news. 25% of the 65 to 74-year-olds have been fully vaccinated. 79% of the 65 to 74-year-olds have received at least one dose of two doses regimen. Our case rate decreased by 23% in the last week. In the last several days, however, our case rate has flatlined. So while we really need to double down and stop the spread of COVID-19, we need to see the cases continuing to decrease so that we can move into the orange tier. Next. This slide gives us a good snapshot of where we're at with the vaccinations in our county. Thus, update, we have received 154,030 doses. We have administered 86,442 as first doses. We have administered 45,676 as second doses. We have administered 3,967 single doses. So this really captures it on the right-hand side. So of what we have been allocated, 88.5% of the allocation have been administered. The remaining 11.5% have been committed towards first dose appointments in the next few days. Next. We heard some wonderful news this week. The governor announced that as of April 1st, all community members 50 plus years of age will be eligible for vaccine. Currently, we are making that available at the Lompoc Community Vaccination Clinic starting Sunday. We have something really neat, really wonderful to look forward to. On April 15th, community members 16 plus years of age will be eligible for vaccination. Next. Appointments are available now at the public health vaccination clinics in Lompoc. And I want to note that because these appointments are available now, we will not be releasing new appointments. Typically, we do that on Monday. We will not be doing that. Public health clinics will be focused on the Lompoc community clinics and second dose clinics in other regions of the county. Our hospitals, pharmacies, and primary care partners will continue to provide vaccinations. Appointments for community vaccination clinics in Santa Maria will be opened on Thursday, April 1st. I want to share that we do have a resource available to our community, and that is the 211. All appointments for vaccination can be made online through public health website at publichealthsbc.org, and it really is the best first approach. However, if you are needing assistance, please call our 211 and press option 4 to speak with a county call center operator. This resource is available for those without access to technology or the ability to use technology or need language assistance to make appointments. Next. Santa Barbara County remains in the red tier. As of this week, we are officially in the red tier for 3 weeks. Our case rate needs to decrease, as I mentioned earlier, in order for us to meet the orange tier criteria. We need to meet the criteria for 2 consecutive weeks before we can officially be moved to the orange tier. So please stay diligent with all your safety precautions. Next. So with that, I want to encourage everyone to do your share so we can reopen everywhere. Please keep doing this. We're almost there. Continue to wear a mask. Continue to social distance. Continue to limit your gathering. Make sure that it's small, it's quick, short, and it's outside. And please continue to get tested. Thank you. And with that, I'd like to introduce Dr. Ansorg, our County Health Officer.
Thank you, Dr. Dorinoso. Good afternoon, everyone. Let me give you an update on what we are finding regarding the virus variants. There are currently various projects underway to gain more information on the type of SARS-CoV-2 virus mutations that are circulating locally in the state as well as nationally. The CDC, for instance, has at least 2 projects where they send representative samples from all over the nation to being analyzed for virus mutations. The California Department of Public Health is currently already analyzing 1.5% of all positive PCR tests in the state of California. We are very fortunate in Santa Barbara County to have UCSB in partnership with Cottage and Marion hospitals to screen local samples for variants on a very local level here. This started a couple of weeks ago, and we do have some reports that are also published on the dashboard. So far, for California, the virus type that has been circulating most widely has been the California or West Coast variant type, also known as B1429 or B1427. And the UK variant, also known as B117, has not been able to suppress the spread of the California type as of yet. Now, please keep in mind that all the reports that we have from the variant testing are lagging behind by about a month. So we are right now looking at sample tests from late February and early March. UCSB will continue to report our local findings on the dashboard. The latest posting was of 12 samples collected in March. Unfortunately, this sample size is not large enough to give a really accurate representation of the variant spread in the county. We are awaiting additional 84 results from March, which will make the sample more representative. Let's stay tuned for those results. We were relieved to get confirmation that all our currently available vaccines are highly effective against any of these newer mutations. The more people are getting vaccinated, the better our collective protection from these more contagious virus strains will be. We've heard multiple reports from people having concerns about the safety of our vaccines. Let me assure you, Our experience after having given close to 160,000 doses locally already, that the side effects have been not severe. We had but a handful of more severe allergic reactions that were quickly managed with appropriate medical treatment and did not lead to longer lasting problems. The idea that somehow the vaccine could cause infertility is still being repeated. Multiple women of childbearing age who were participants in the earlier trials have successfully become pregnant without problems after receiving the vaccine. There's absolutely no scientific or even anecdotal evidence that these vaccines have any impact on fertility at all. Unfortunately, misinformations like this continue to circulate on social media and online blogs and websites. Please be sure to get your information from trusted resources like CDC, CDPH, or publichealthsbc.org. Given the risks of infection with the coronavirus and subsequently suffering severe acute COVID, leading to permanent lung damage or even death, or leading to the dreaded long COVID symptoms of lasting fatigue, memory loss, headaches, etc. By far, the best protection will always be to get the vaccine. I urge everyone to be on the lookout for when the vaccine becomes available to you and jump on the earliest opportunity for your own and everyone's safety. As of April 1st, as you've just heard, anyone age 50 and above will be eligible for the vaccine. Everybody above 16 years of age will be eligible after the middle of April. Spring break is obviously upon us. Please be advised that California is still under a travel advisory. Please do not travel outside the state or country and limit day trips to a radius of 120 miles for now. Also, be advised that you do need to quarantine for 10 days upon return from out of state or international travel, if you did indeed travel. We are well poised to be reaching our local home stretch towards conquering this virus. Let us not waste this real opportunity by getting lax about distancing, mask wearing, and avoidance of crowds too early. Thank you for your cooperation.
Thank you so much for those updates. Now we're going to open it up to questions from the media. First up will be Blake Devine with KYT, followed by Tom Bolton at Newshawk.
Hi guys, first question for me, Vaughn, when you were talking about our case rate has flatlined, could you just describe what that means?
Yes, it means that it is not on a downward slope as quickly as we are seeing. It's plateauing.
And what can that be attributed to, and what can people do to help that continue to decrease so that we can get into the orange tier?
I want to say that we just need to be more diligent in following our guidelines, in wearing our mask, in not gathering, and in keeping our gatherings short and guarding our social distance. I think that when we get relaxed in our safety precautions, that's when we see a plateauing of our case rates. And we'd like to see it downward.
How close are the numbers to reaching those orange tier criteria that we need?
We ran the numbers and it looks like we are at 5.1 as of today. And so we need to be below 4. And I am projecting that we can get there we can meet the criteria perhaps within a week or 2 weeks.
Makes sense. Last question for me. This is coming in from a viewer, and they were wondering if the county could set up a COVID-19 vaccination pod for the UCSB community, including staff and students. Is it within your power to do so? Obviously, UCSB Isla Vista is a large defined congregate population. So I was wondering if you could just answer that.
That's a great question. I believe that Cottage on a Zoom meeting with my hospital colleagues, Cottage has indicated that they have open vaccine opportunities to the UCSB campus and community.
Oh, thank you so much. Appreciate it.
Thank you. And now we're going to Tom Bolton with Newshawk.
Oh, thank you very much. I just wanted to follow up a bit, I guess, on Blake's question to Dr. Donovan regarding the plateauing. If you look at the active cases, it's actually not a plateau. It's up a fair amount from even earlier in the week. And I just wonder if you could elaborate on what you believe is causing that. Is that just an aberration, or is something changing that needs to be addressed?
Yes, great question, Tom. I always want to say that we have to be careful and not take a single day or a single couple of days and the trends that they don't offer. And we need to look at it from a weekly or bi-weekly rate change. And so when we see a blip in daily case rates, it could be because of a aberration in the test results being logged in being cleared and attributed to the right day. So that's part of the data cleanup at the state level and even at our level.
Okay, so you don't think that the cases have ceased to go down truly, or
Correct. We're noting that it is plateauing. So we want to see a continual, sharper slope decreasing downwards.
sort of a related question is, I guess a lot of student athletes are getting tested now, and is that contributing to any increase in cases being detected?
I can speak to that. I don't think the numbers are large enough under the student athletes to make a real dent, fortunately.
Okay, thank you very much.
Thank you, Tom. Next up, we are going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Okay, my first question, well, our Hispanic audience has been telling us that they are still concerned because they haven't been able to get an appointment to get vaccinated, not online, not by telephone, because, you know, technology is hard for them, and also because the schedule, for example, 9 a.m. is impossible because they are working, and they are very concerned about that because when they use the telephone line that Dr. Banda Reynoso just reminded us, this 211 and then the option 4, they don't get anyone to answer, and it's just a recording, and it's the same when they call the hospitals, they just hear a recording and then they don't get a response. So they are really desperate about this. What can you help us to tell them about this?
You know, I can sympathize definitely. It would be very frustrating when community members can't access the appointments that they need. So a couple of things. Our Lompoc clinic will be running from 9:30 to 6:30, starting on Sunday, running for 7 days. So I encourage our community members to access those later at times. We will be doing the same in Santa Maria next week with the 6:30, the later in the afternoon appointment still available. With regards to calling our 211, want to encourage community members to call 211 and press 4 so that you can get into our county staff. We have doubled our capacity. We have increased staff, and with language accessibility. So our staff and our language line will be able to speak to our community members in Spanish or Mixteco. We are here to help. So I want to encourage community members to reach out to us if they are having difficulties. In addition to that, there are community organizations also ready on the standby to assist as well, such as MyCop, such as CAUSE, such as Herencia Indígena, and various. And I also want to encourage community members also to tap their own network of family and friends to see if they can be of help. But 211 press number 4, we are here to help.
Okay, thank you. My next question is from businesses. They want to know if the public health department is going to make mandatory for businesses employees to get vaccinated.
At this point, no, because it is on an emergency authorization use from the FDA. The Public Health Department will not be mandating that employees be vaccinated.
Okay, thank you so much. That's all. Thank you.
Thank you, Fabiola. And then next up, we have Atmika Iyer with the Daily Nexus.
Hi, hope everyone is doing well today. I have 3 questions. My first one is, I know that April 1st is the beginning date for statewide for people 50 and older to start getting vaccinated, but based on the press release from yesterday, it seems like Santa Barbara County is beating that deadline, which is awesome. And I was wondering if the same might be true for the April 15th deadline for people 16 and up to get vaccinated.
Yes, so we will be allowing 16 plus to schedule appointments beginning April 12th, because that is when our clinic for that week starts. We will be running a 5-day clinic starting on April 12th. So yes, we will be making that available to community members 16 and above.
Awesome. Thank you, Dr. Del Reynoso. My second question is, so with the fact that people 16 and older will be soon able to get the vaccine, a lot of college students living in Isla Vista don't have cars, they have bikes. And the closest place to get vaccinated is in Goleta, and I believe it's a drive-through. So taking that into consideration, will there be any other clinics or places near Goleta or Isla Vista that will be more accessible to students without cars?
That's a great question. And as of now, no. We will be offering the Santa Barbara mass vaccination clinic that is run by the Public Health Department at the Hilton downtown. Unfortunately, at this time, we will not be expanding that. We will just be for the 5 days at that Hilton location. However, like you mentioned, we do have our partners cottage at the Goleta Hospital and other clinics throughout Goleta as well.
Awesome, thank you. My last question is, considering that Santa Barbara County is the one responsible for serving houseless residents, I was wondering if there has been a plan currently to start vaccinating them, if that's already underway, and what that looks like right now.
Great question. I'm glad you asked that. Yes, we have been vaccinating our unsheltered community members. That effort has been underway for at least 2 weeks now. And we are partnering with community organizations and healthcare partners to do so.
Awesome. Thank you so much, Dr. Dovernoso.
Yes.
Thank you, Atmika. And everyone, that actually concludes our questions for today. And a note that the Board of Supervisors will not be in session next Tuesday, but the next press conference is Friday, April 2nd at 4:30 p.m. We will continue to issue updates and information to the media via social media, to our e-news subscribers, and of course posted on publichealthsbc.org. As a reminder, each Thursday in the 11 a.m. KEYT news broadcast, News Channel's Joe Batista will interview county public health experts to bring you live updates and information. As a matter of fact, yesterday, Dr. Do Reynoso broke news about our expanding vaccination eligibility. So that was breaking news at 11 a.m. yesterday. For more information and links, of course, access the publichealthsbc.org website. You can make appointments at the Lompoc Clinic that Dr. Do Reynoso mentioned. You can also call 211 for assistance making appointments. Just as she mentioned, select option 4. And with that, we wish everyone a safe, healthy, and happy weekend, and we will see you next week. Thank you so much, everyone, and have a good night.
Thank you.